Hello, everybody. Good morning. I thank God for your lives and I thank God for blessing us with another week. We are back to continue from where we left off regarding our topic, high blood pressure. Today, I'm going to talk about the signs and symptoms, even though mostly there are no signs and symptoms, of high blood pressure. And I'm going to talk about what to do if you are diagnosed with that and the complications that you have to know. All right. So basically, high blood pressure mostly don't come with signs and symptoms. That's why we term it as a silent killer. By the time you realize you are in the complication of high blood pressure, you are dying. Okay. So you don't have to wait and experience signs and symptoms before you check your BP. The best way to diagnose it is by checking your blood pressure. So it's very pertinent that always, every now and then, you check your BP to be sure you have a normal BP. Okay, so basically, some of the signs and symptoms, you have headaches, blurred vision, dizziness, you have chest pain, um, nosebleeds, sometimes nosebleeds, abnormal heart rhythm or abnormal heartbeat. Okay, so your heart will be beating abnormally, let's say palpitation. Suddenly you're experiencing rapid heartbeats, then buzzing in the ear. Okay, you can hear or you can perceive you're hearing some sounds in your ear, but there is no external source. All right. So basically, these are some of the signs and symptoms. You can have nausea, difficulty in breathing, even vomiting, because when your BP goes very high, you can vomit. You can be experiencing, frequent vomiting. Okay, so that's some of the symptoms and signs you have to know. And the treatment, usually, I will advise you after seeing your doctor, you resort to lifestyle modification as well. We mentioned some diet, saturated fat, and trans fat. You will try to do away with them. If you didn't watch my the part two, you should go and watch it because that talks about the the saturated fats, the lifestyle, you know, stuff that can lead to high blood pressure, sedentary lifestyle. You have to be exercising. You don't want to be inactive. Okay. You don't want to take tobacco, which can increase your blood pressure. So you do away with all these lifestyles together with the drugs your doctor has prescribed for you, then you will be fine. All right. So you lose weight and all that. Then the complications, you will talk about chronic kidney disease, okay, heart failure, heart attack. Basically, we will say myocardial infarction or something. Yeah, heart attack. Then stroke. Yes, stroke, heart failure, kidney failure, chronic kidney disease, and all that. So, thank you very much for watching or for being with me throughout these 4 weeks. I believe that you have been blessed with this topic and you are going to live as expected of you so that you don't find yourself in this situation. And those who are already also in this situation are going to learn to adopt lifestyle changes so that you will be fine. Although it is not curable, some people are able to, with time, through taking their drugs and adhering to lifestyle modification, abate their BP to the extent that they are not asked to take the drugs anymore. Okay. All right. So this is what I'm leaving with you today. We talked about the signs and symptoms, and I advise that mostly it doesn't come with signs and symptoms. And the best way to diagnose it is to checking your BP. All right. So always try. If you don't have the machine, go and get one, the automatic one or the digital one, to be checking your blood pressure every now and then. And if you can walk to a nearby pharmacy too, sometimes they have it, or a nearby clinic, they can also help you checking it. All right. Thank you so much. Have a blessed week. We are back to our daily bread coming Monday. That's this Monday's week. We are back to our daily bread. Keep on watching, stay tuned, and your life will never be the same. Have a blessed week. Bye bye.